It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Thanks for tuning in, folks. You know, it's crazy out there today, you know, with the coronavirus. And I'm so happy to see the media doing the right thing this time, where they're keeping us informed on a daily basis, because things are changing every day, as we know. And I guess the more information we can get, the better off we will be. We just are, as President Trump says, we're all in this together. And so I thought it'd be interesting to talk to a head of orthopedics, no stranger to our system, Dr. Tom Meade. He has his own show here on SSP TV. Come in and talk about, you know, the viewpoint of orthopedic medicine and how does that affect, and some other comments that Dr. Meade has. Tom, thanks for coming on the show.
Sam, thanks for having me. I have a busy orthopedic practice, and as you said, I'm the head of knee arthroplasty at Coordinated Health, which is now part of Lehigh Valley Hospital. So, you know, I'm happy to be invited here and talk about how this has affected my orthopedic practice and my patients. I'm not here as a spokesman for Coordinated Health or Lehigh Valley. They have done a great job recently with actually in our area up here, having a press conference headed by the head of infectious disease, Dr. Luther Rhodes, who I have known for over 35 years. He's really an all-star in the infectious disease world, and he's probably one of the smartest infectious disease doctors I've known. So he did a great briefing here, and that was the word from Lehigh Valley. But this has affected, you know, my practice and my patients. But before I get there, you know, I want to know how you're doing, because you're in that group that we read about on the media that really should take some extra precautions. And you know, we're not shaking hands anymore or hugging, but I just want to make sure you're okay and your family's okay.
Well, we instituted here at the station, you know, thank God I have a wife. Okay, and I have 2 children who are on top. Yeah, but you know, we're being as careful as we could. Okay, we're not going out covering things we used to cover, but the most important thing, Tom, is when I started this in 1994, and this was in our anniversary show. The reason why I started local television was to inform people of what's happening in their neighborhood, and that's, thank God, has been the success of SSP TV, and it. You know, it's gratifying when people come up to me and say, Sam, you know, thanks for what you're doing. And I'm not being braggadocious here, but at least I know that the public is getting the information just as here. So we're doing fine, thank God. Hopefully we'll continue to do that. But what we want to do is try to provide information, okay? So let me ask you this, Tom. You've been a doctor many, many years, okay? You're one of the most successful orthopedic surgeons in knee. I mean, you're probably the leading one in the state and top in the country. How does this affect, you know, orthopedic surgery right now? Because they're saying selective surgery. So I have a concern, because if I have a terrible knee problem or hip problem and I'm in pain, I don't know if that's selective. I think that's, I mean, to me it would be, can't you give me, but you have same day surgery as well, right? So I guess I'm throwing a lot of stuff at you.
No, it's appropriate. If you just, I'll look at my practice over the last 30 years, you know, and ironically, I trained with Luther Rhodes' brother, Mike Rhodes. He was a trauma surgeon at Lehigh Valley Hospital. Lehigh Valley Hospital was the first level 1 trauma center in Pennsylvania. They essentially started trauma centers in Pennsylvania. Dr. Luther Rhodes' brother, Mike Rhodes. And for my first 15 years here, I did level 1 trauma. And that surgery still goes on. There is no lapse in level 1 trauma. Today, if you or I, Sam, go out and we get in a car accident on Route 93 and someone hits us head on and breaks our leg, we will fly right to the nearest trauma center, and that surgery goes on. So my practice has evolved where, maybe 10 years ago, I've sort of transitioned, and I did less and less trauma, and I did more and more elective surgery as my patients got older. So now my practice is 100% elective surgery. So most of my patients come in, they're not sick, they're not dying, they have a knee problem. They tore a meniscus, they tore an anterior cruciate ligament, they have advanced arthritis. They need anything from injections to medications to a minimally invasive procedure to a partial or a whole knee replacement. All of those procedures are now put on hold. They are not canceled, but they're postponed. But Lehigh Valley has done a great job. They developed a tier system, and they've stratified the surgical cases 1 through 4, 1, 2, 3, 4. A level 1 case is emergent that has to be done, just like we talked about. Level 2, 3, and 4 are various gradations of urgency. And really, at the bottom of the list are elective surgeries that can easily be put off for 2 to 4 weeks. And that involves most of my cases. So to tell you how quickly this has transitioned, 3 or 4 days ago, both Coordinated Health, which is now part of the Lehigh Valley Healthcare Network, put out a statement and in the paper that, nothing has changed from an office visit or procedure. Keep your office visits, see your doctors, your procedures will go on. That changed dramatically. So as of yesterday, all elective procedures have been put on hold. And this is pretty much nationally by the Surgeon General. So we've all called our patients, and there are patients that can't wait, Sam, because even, quote, elective patients, they may have reasons where it has to be done. We may have prepared them specially. They may have stopped certain medications, blood thinners. Yes. They have family coming from out of town. It's an urgent situation. Other instances, they may have an infected knee. That can't wait. So all of those cases can go ahead, but we're doing them on a one-by-one basis. We're evaluating them. But for all intents and purposes, for the greater good of the community, so we could save our resources, save exposure. Those are the 2 reasons, supplies and exposures, that we're putting elective procedures on hold.
Okay, so that's the question I want to ask you. So when people hear this, there's more panic. There's more, oh my God, now they start to say, okay, what's going on? Is the world coming to an end? And look, I mean, we've seen this when they announced it. I mean, everyone's going hoarding stuff and they don't know what's coming on. So, number one, are we overreacting?
So, well, there's 2 aspects to that. Is the government and our healthcare institutions overreacting? And the answer is absolutely not. If you listen to Dr. Fauci, if people are accusing him of overreacting, he said that means he's doing the right thing. So the price of underreacting is far exceeded by not acting enough. So certainly we have to do the right thing. Are people overreacting? Are people panicking? Maybe. The answer is yes. Your examples, they're going out, emptying the stores, they're buying toilet paper. But I can understand why, because for 24/7 they're inundated on the media with this information. And so there's a lot of uncertainty out there. This is new. And it's really a pack mentality. Why are they doing it? You see pictures of empty supermarket shelves. Their neighbors are doing it, so they're doing it. So it's really perhaps an overreaction, but it's understandable on the people's standpoint.
As I mentioned when we opened the program here, things change daily, as you just related to with selective surgeries. So when, as a surgeon, looking at, what has happened in the past, where we are today. Now, the virus itself, the coronavirus, okay, what is it and is it deadly?
So Dr. Luther Rhodes, this week did a great explanation. It's a virus that causes symptoms similar to the flu. The flu is a virus that causes very, very similar symptoms. Why aren't we having the same reaction? Well, basically because a lot of it is unknown. It looks like it's more contagious. It looks like it has a higher mortality rate. And we have the ability to look into, the rear view mirror and see what's happened in other countries, like China and Italy. And so we don't want to get there where it looks like there's a spike in the death rate and we haven't reacted enough. And I think, it's kind of like watching a football game. and then criticizing it on Monday morning. We could all do things differently that we could have improved upon, but I don't think that helps the situation. I think it is what it is. We did a lot of good things in my mind. Within a few weeks, we shut off the flow of people from China where it originated, and we put this public-private partnership together. Now we basically shut down non-essential businesses for 2 weeks. I think all of that is good, and that's an attempt to slow. We can't stop this virus, but we could slow it down. So the major reason is we don't want to overwhelm the healthcare system. We don't want to overwhelm the hospitals, and we really don't know what's going to happen because the numbers aren't there yet, but we don't want them to be there yet. You're more likely to die of the flu this year than you are of the coronavirus. But it is a virus, and there are some differences. And there's some differences in the symptoms too.
What happens? You hear about the deaths of coronavirus, but from what you hear is anywhere from 90 to 95% of the people that get it do not die. Okay, I mean, this is what you hear out there. So what is it? Why do these people die?
So why do they die? If you look at how does the let me address the number. Come back to the numbers. I'll tell you how later. Well, because it's a virus that you get exposed to in your mucous membranes, either through your nose, your eyes, or your mouth, and then the virus replicates in your throat and it works its way down into your lungs. And then it can actually, though, become a systemic problem. It can actually go to the other mucous membranes in your body, into your GI system, and cause a systemic problem. So you can get a viral pneumonia, and then your lungs get tight and you can't breathe, and that's the reason we need all of those respirators. The viral pneumonia can turn into a bacterial pneumonia, and then the same sort of treatment is involved, although antibiotics can treat that, which they can't treat the virus. Or you can just have a systemic, overwhelming viral infection. So that's sort of how you die. But if you look at the numbers, and I'm a numbers guy, I have to look at the numbers to keep me sane. If you look at because we have so many numbers on the virus, and the death rate is under 1%, like 0.1%. We don't really know the mortality rate. It's all over the place. And so we won't know until all this is done. But if you look at the best folks or the best numbers, Dr. Fucci said it could be 10 times, you have to be careful with statistics and numbers, it could be 10 times the rate of a flu, but if it's 0.1 on the flu, that might be 1%. But the South Korean data looks like it's maybe 0.07%. So it's still under 1%, but it does look like it's higher than the flu. But if you look, then let me get back to the numbers. So if you look at the numbers, there's 200,000 people worldwide that have this. Well, in our country, we have 26 million this year that have the flu. I mean, that's a factor of thousands. And so there's more people have the flu in this country than have had this worldwide. And what I like to say is that they don't emphasize that 80,000, have recovered. There's about 8,000 deaths, worldwide. So I like to put the numbers in perspective just to keep me sane.
Folks, I'm talking to Dr. Tom Meade. Now, folks, I'm going to put a number up there on the screen. Dr. Meade has his own show, and when he's doing his lectures, people have called the station wanting to know how to get in contact with him. So I'm going to put his number up on the screen. This is his number. It's 1-877-247-8080. That's 1-877-247-8080. So, if you have problems with hips or knees or whatever, that's his number. However, if you if you feel you have any symptoms, all right, of the coronavirus, this is the number to call. It's in 888-402-LVHN. That's if you have symptoms, call that number because there's directions they're going to tell you what to do. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Remember, 24/7, You can watch all of our shows on ssptv.com. No more app, only because when you go to the website, you'll understand why. It's all of them. It's very easy to get to all of the shows. YouTube, for those of you who do not have cable and you're telling your friends about our different shows. Comcast 190, Pottsville, from 7 to 11 p.m. Wilkes-Barre, Service Electric Communications, Channel 92, 7 p.m. to 11 p.m. every Saturday and Sunday evening. And in the Lackawanna area, Comcast 190 on 8 to 11 a.m. Saturdays and Sundays. My guest is Dr. Tom Meade. We're talking about the coronavirus. Tom, some things have changed. When people come into your office, what do they see?
Sam, it's an amazing difference. So on a positive aspect, we're not doing elective surgery for the next 2 weeks, but it opens up the office to see more patients, and we're not really filling the office with 70 or 80-year-old sick patients that are at risk. But as you said, a lot of folks, I saw a patient this morning that came in and they called and they fell. They had a big swollen knee and they said, I'd like a prescription for opioids. And we said, we're not giving you a prescription for narcotics. They said, well, I don't want to come out or come in. I said, well, come on in, because we really take a lot of precautions in the office. And the patient came in today, they had a knee full of blood. I drained it. We put a little Novocaine in the skin and gave him some anti-inflammatories. But that was a trade-off. Instead of, this patient expecting to get narcotic pain pills. So what do we do now that's different? It's a whole different ballgame. So the patients get called 24 hours ahead of time and they get screened. There's a series of questions that we go through to make sure that they don't have the symptoms of the coronavirus, a fever, a cough, any shortness of breath or trouble breathing, which is one of the differentiating factors from the flu. If they pass that, they come into the office. What do they see? They see a whole different dress code in our office. They either have our front desk people that are in the front line, and God bless them, they're out there, and they have a face mask and a shield. If they don't have a shield, they're wearing goggles, because remember, transmission can be through the eyes, the nose, or the mucosal membrane in your mouth. They get screened again. If they pass and they have no symptoms, then they come back and we can see them. And if they don't, if they have symptoms, they get a mask put on them. They give the number of Lehigh Valley 888-402 LVHN, and they go through another screening process to see if they're going to get tested. If they come back, my interrelationship has completely changed. And it was always very personal. There's no more handshakes. Yeah. Patients hug you. They have an operation. You've changed their life. Their family hugs you. And it really is a killer, but it's necessary. I wash my hands. They're so raw now from alcohol and hand sanitizer. Instead of, it's not unusual to do it 2 to 4 times between patients. Yeah. So everything has changed.
All right, so is there a vaccine out there? I'm understanding that there is a vaccine. I don't know if it's rumor or what. Is there a vaccine out there?
There's no vaccine for the coronavirus. As of today. But the first patient was injected out in Seattle. It was a volunteer, and it looks like there's nobody better than the United States. When we rally all of our forces to fast track a vaccine, and I have no doubt that this will not be the usual vaccine lag. It may not be weeks or months, but it won't be years. So that was encouraging. So we're rapidly testing. The FDA has put down all the barriers, so we're full speed ahead on that.
Tom, what do you think we've learned from this so far?
There's always a silver lining to every crisis. And again, I always have to look at the numbers to keep me sane. But I was on your show, a year ago talking about the opioid crisis that kills 50,000 people a year, more than car accidents that kill 50. So we have these numbers out there. I remember, 130 people a day are still dying of the opioid crisis. We've only had 100 deaths from the coronavirus. We have 100 people a day dying of opioid crisis. So I just want to keep it in perspective so that I remain sane on this. But we don't want that to go up exponentially, which is why we're doing all that.
Speaking of that, okay, so as more and more people are getting tested, so when you hear And yesterday, 50 more people were, so now what happens, oh my God, this is really getting crazy, okay? Why is that?
So we're going to see a huge number of increases in the next couple days or weeks. And the mistake to be made is that this disease is going crazy. We've implemented all of these processes to flatten out the curve. But right now, the ramping up of the testing just came out. So there's a lot of cases out there that aren't recorded, but they will be recorded now because we test. So we can't monitor this day by day by what the media is reporting, especially over the next week or two, because it's going to skyrocket because millions of tests are out there. So we have to keep that in perspective. But you know what we've learned? I think what we've learned is, number one, is I didn't know that 97% of all our antibiotics were made in China. I mean, we've got to reevaluate this. And then
I think Trump is.
Well, he is, thankfully.
And he mentioned that.
And then they used it as a veiled threat against us that they're going to, overwhelm the United States in the Corona Sea, meaning that they could withhold these antibiotics if the United States doesn't stop calling it the Wuhan virus or the Chinese virus. But for heaven's sakes, that's where it started. So I don't think we have to look at that with a skeptical eye, and they're blaming our military. So there's this game going on. So number one, I think we have to bring manufacturing home, especially for critical things, Sam. I think we have to keep a skeptical eye on what's coming out of China. They've just threw out, I think, the New York Times, Washington Post, Wall Street Journal journalist over there. But you know what's neat is it may be the crisis that brings our bipartisan country together. It's one of the few things I've seen in the last couple of years that they could agree on.
Well, I hope you're right, okay, because that's a whole other issue. The media, as I said before, I'm happy to see that the media is reporting factual truths, other than what we've heard in the last couple of years, Tom. And it's just so sad because they try to brainwash people. But now they are presenting facts, such as we're trying to present facts on a local neighborhood program. Where do you see us going, Tom, as a medical surgeon? Where do you see us going?
With this crisis, you mean? So I think that, well, just like the bipartisanship in Washington, I've worked at Coordinated Health, St. Luke's, Lehigh Valley my whole career. This week, Lehigh Valley and St. Luke's put out a joint statement where they're working together. We want to have the same processes and policies in to prevent spread. So they have the same policies where they're limiting visitors in the hospital. They're eliminating elective surgery. They have the same warnings out there for people. So, I just think it's great that the healthcare units are actually working together. So I think we have some of the best people in healthcare, but we are fortunate in this area, Lehigh Valley, Luther Roads, and I think we're going to get over this. We're going to get over this.
In closing, I have 1 minute left. Should we panic if you have the coronavirus?
Absolutely not. Most people don't even know it. They have minimal symptoms or have no symptoms, and the majority of people obviously aren't going to die. We don't know the numbers, but really the people that should be concerned that have the highest mortality rate are people that are elderly, that have comorbidities. So smokers, it's another reason to stop smoking. You have young people that go, I'm young and healthy. You go, oh no, if you're a smoker, you're in the older person category because you have a higher risk of catching the disease. But we're going to get over this, Sam. It's a crisis. The United States is great. We're going to win on this.
Get a hold of Dr. Meade, 1-877-247-8080. Folks, he has his own show again, back on air, and you can watch it on all our systems. Plus, any questions you may have, if you feel symptoms, they advise you to call 1-888-402-LVHN. Now, this changes every day. That's why you'll get tuned into our news at SSP TV every day at 5 o'clock. And, of course, we do a number of repeats with updates. We'll see you next time.